This is the final project video for eHealth724. Group members are Paul Brown, Dwayne Bender, Andrew Norgate, and Chloe Nitre. Our proposal is for a provincial healthcare app formulary. Meet Roger Sterling, a senior living with diabetes and COPD who is interested in using his smartphone to manage his health but isn't sure what app to use. Dr. Meredith Gray is his physician, and Roger has asked her for recommendations regarding what apps he should use. She promises to look into this for him and will give him some choices at the next follow-up appointment. Later that afternoon, Dr. Gray searches for apps she can recommend to Roger, but is overwhelmed by the sheer volume of apps. Trying to determine which ones will be easy to use for Roger but are accurate and clinically relevant is difficult. She finds a few ways to help in the selection of apps, but they may not provide the information needed to make a clinical decision. Dr. Gray learns that App Store ratings aren't effective at determining quality and usability. The problem is that when an app is uploaded to a store, it accumulates ratings over its lifespan. This means that an app can have thousands of ratings, which isn't a true reflection of the effectiveness of an app over different versions. The biggest factor is that there's no clinical validation of the app. Researchers have created rating frameworks to determine the effectiveness of apps, but many are relying on App Store usage and content analysis rather than evaluating their effectiveness with patient outcomes. Many of the rating systems don't take into account the usability and accuracy of an app from a user perspective, and because they rely on App Store ratings, Dr. Gray doesn't trust them. The MARS framework was developed by researchers for the evaluation of the quality of health apps, which doesn't rely on the App Store star rating system. A literature search of web and mobile app quality rating criteria was conducted to establish assessments which contribute to mean scores. Although reliable, reviewers must have relevant clinical and technical knowledge and unfortunately doesn't provide clinical validation. Meredith also found physician review websites where selected healthcare apps are validated for medical accuracy and functionality. Each app is evaluated over a period of time where physicians determine the pros, cons, and accuracy of the data. This provides a form of clinical validation but doesn't address the usability and functionality for the user. After hours of searching, Meredith has only two options. Option A is to continue looking on Google Play or the iTunes Store, relying on user ratings, trying to navigate hundreds of apps, and not knowing how clinically relevant they are. Option B is to find an app that is relevant to Roger's needs, but she'll need to find clinical reviews, apply the MARS framework, and evaluate its quality and usability. At this point, Dr. Gray is overwhelmed and realizes that after many hours of research, she still hasn't made any progress for Roger. She now realizes that we need to bring clinical validation and technical expertise together to evaluate apps effectively. We also need one place for providers and patients to access the apps, which can also be used to educate and submit reviews. Meredith wonders what if there was a way to integrate all the best ideas from how others have solved this issue into one scalable solution, and what if we modeled it after a drug formulary? It could be searchable, evidence-based, adaptable to patient preferences, and most importantly, available at the point of care right from the health information system that they use at the clinic. This formulary would need to research and summarize clinical evidence, take the results and use it to create a specification that developers can use, validate the app against the standard, centralize all the validated apps in a location that is accessible, and collect clinician and user feedback to further refine the process. This formulary concept could support the prescribing of apps by clinicians to patients, provide a way to measure and monitor the effectiveness of the app, open up the possibility of third-party insurers to pay for treatments, have one central location for the education and support of healthcare apps. To advance the integration of effective mobile health apps, Dr. Gray proposes that providers in Ontario are equipped with the ability to move towards prescribing apps. She submits that the Ministry of Health and Long-Term Care Ontario implements a comprehensive apps formulary for Ontario's healthcare system with input from healthcare organizations and associations. Implementing the formulary at the provincial level will ensure that the proper authorities are put in place, including regulatory and legislative changes, and allow for the development of an appropriate change management strategy for the healthcare system. Prescribing apps puts the patient on a specific course of treatment that can be supported by clinical protocols and can be measured and monitored in a structured way. For an app to be listed in the apps formulary, it must follow a three-stage inclusion process: the clinical research stage, the development and verification stage, and the deployment and operations stage. The goal of the clinical research stage is to collect and summarize clinical evidence about digital health interventions that are effective. It allows the app's formulary operator to distill literature reviews into actionable specifications that can be implemented in health apps, effectively setting best practice guidelines for apps as seen in other areas of clinical practice. In the research stage, researchers generalize evidence about managing conditions using health apps and specify features that are known to be safe and effective without having to conduct additional clinical trials on every individual app. Published study results from research trials and systematic reviews will be used to create conformance profiles. Conformance profiles will serve two main purposes. They'll act as succinct evidence-based guidelines for developers to use when designing and building their healthcare apps, and act as a testing framework in the validation phase. Conformance profiles will help to define what an app should do for the patient, as opposed to what an app can do for a patient. Profiles will also have the flexibility to include jurisdictional regulations, legislative requirements, health provider governance, organizational policies, and relevant existing technical standards such as terminology nomenclature. They'll also define other required non-clinical functionalities such as interoperability, privacy and security, and user data safeguards. The app formulary needs to be populated with safe and effective mobile health apps. The development and verification stage will ensure that all submissions meet the specifications published in the clinical research stage and are compliant to the conformance profiles. Conformance profiles are developed for each chronic condition, and one or more profiles can be combined to create and manage apps for multiple comorbidities. By treating profiles as a descriptive model of all the rules and actions that an app must take, it supports the gathering of functional requirements and aids developers in the build process and provides the clinical guidance that many apps don't adhere to. Once developers have created an app and would like to publish it in the app's formulary, the app is submitted to a third-party test center for verification testing. The center will verify the app adheres to the conformance profiles and also ensure that the best practices are upheld in privacy enforcement, security measures, usability, auditing, performance, and other non-functional attributes. Once verified and published, the app has entered the deployment and operations stage, which means they're now available to be prescribed by clinicians to patients, both knowing that the app is safe and effective. This process reduces the risk to the clinician and the health authority under which the clinician is governed, and allows for official support of the patient using the intervention. The prescription process for the health app supports an electronic workflow. Using the app's formulary portal, the clinician can access and review recommended apps. They can then e-prescribe an intervention to the patient. An electronic notification is sent to the patient to activate an instance of the app via standard means such as text messaging, email, or access through the formulary portal. The patient downloads the health app from the formulary and subscribes to the intervention. They begin using the app, and based on consent from the patient, usage pattern behavior and other data are provided back to the formulary. This can also support subscriptions to support groups, virtual clinician encounters, or support resources where apps installation and support assistance can be provided. Apps will have a scoring model applied to it that encompasses a multi-dimensional subset of factors that includes clinicians, patients, administrative, which encompasses cost and performance factors, independent testing, and developer ratings. App scoring will be reflective of the version and dynamically update as app versions change. Fast forward to a provincially supported app formulary, Dr. Gray is now able to search recommendations for her patients and be confident that they are clinically validated and safe for the management of their health conditions. What used to be a long, confusing, and frustrating experience is now part of her approach to patient-centric care. At Roger's follow-up appointment, Dr. Gray shows him her recommendation and provides an overview of the app functionality. Roger is impressed with how easy it is to use and agrees with her selection. While they continue to discuss the app, Meredith e-prescribes the app to Roger, and an electronic notification is sent, which he verifies received on his smartphone. As technology and apps evolve, new devices and solutions are being discovered daily. As data converges from disparate sources, devices such as Fitbits and Google Home can be expected to change how health is interpreted. Short-term future plans of the formulary is to expand and include consumer wearables, and long-term goals are to incorporate remote monitoring devices. We hope you enjoyed our apps formulary presentation. Thanks for watching.